We're good on recording.
Good. Thank you, guys. Thank you so much. All right. The next is Harold Davis Jr., RVT, VTS, ECC, Anesthesia, and Analgesia. Harold Davis is a veterinary practice educational consultant and the former manager of the Emergency and Critical Care Services at the UC Davis William R. Pritchard Veterinary Medical Teaching Hospital. As co-founder of the Academy of Veterinary Emergency and Critical Care Technicians, Mr. Davis was instrumental in obtaining from North American Veterinary Technician Association provisional recognition for technicians as specialists. This is the first organization to receive this acceptance. He is also a chapter member of the Academy of Veterinary Technician in Anesthesia and Analgesia. He is the past president of the Veterinary Emergency and Critical Care Society. Harold is the first non-veterinarian elected to this position of this 5,000 plus member organization. Sorry about that. He currently serves, get away from the truck. Currently serves as president on the board of directors for the North American Veterinary Community. In addition, he is the treasurer of the board of directors for the National Association of Veterinary Technicians in America. Harold is the recipient of many awards and honors, most recently the 2020 Continuing Educator of the Year Award, veterinary technician at the Western Veterinary Conference in Las Vegas. He is an international speaker and has spoken in 14 countries. In addition, he has published several books, chapters, journal articles, and is currently working on the second edition of his co-edited book entitled Advanced Monitoring and Procedures for Small Animal Emergency and Critical Care. Thank you very much, Harold, for joining us. We're super excited. Oh no. Sorry, I have to scroll down and find everybody else's bios. Oh my goodness. I really apologize for this, everybody.
I can introduce myself while you look, Shay.
That would be great. Thank you.
If anybody, some time. Hey,
that'd be wonderful.
Yeah, no problem. Hey, I'm Steven Cital. I'm an RVT out of California, also a registered lab animal technician, certified veterinary pain practitioner in VTS and lab animal medicine, with a focus on research anesthesia. Been a part of a bunch of things, a lot of them with a lot of the people on this panel, which is really fun. So it's fun to get to hang out. And I will just note that it is pretty cool to have 3 males. Love the females, total feminist, but it is cool to see 3 males on a panel, especially when it comes to vet tech. So I love that. I am currently at Stanford University as a lab manager and am now a partner in a specialty practice focused on neurology and pain management. That'll be opening soon in the California Bay Area, called Remedy Veterinary Specialist.
Wonderful. Thank you so much.
No problem.
Imeldo, do you mind introducing yourself too, since I'm struggling to find your bio?
That's good. I can introduce myself. My name is Imeldo Laurel, and I'm an RVT, VTS, and Dentistry. I've been in the field for about 18 years. I've done emergency, general practice, and specialty dentistry. I'm currently working in Washington, D.C. I work with the boarded anesthesiologist, and I'm going to be rotating between anesthesia department and dentistry. And I started lecturing. I gave my first lecture in 2021, and I have continued lecturing since for different conferences.
Wonderful. Thank you so much. Tracy, I'm so sorry. Would you mind introducing yourself as well?
No, I don't mind at all. Hi, I'm Tracy Bagtas. I'm currently the lead surgery technician at a new hospital in Greenville, South Carolina called Fetch Specialty and Emergency. I've been a licensed technician since 2006, and I obtained my VTS in 2017. Since then, I've been serving on the pre-applications committee to help guide those that are interested in joining the VTS Academy in Anesthesia and Analgesia, and also served as a mentor the past few years as well for people's applications that have been accepted.
Awesome. Thank you guys so much. Again, I just cannot express how much I appreciate you all. So we wanted to just kind of get started and find out a little bit about you guys and your journey to becoming VTSs. Who would like to go first?
Well, I think Harold should start because he literally started it all. So
Sure, I'll be happy to jump in. I think my path is probably a little different than most of the people on here, in that when I started with the specialties, there wasn't one. I actually happened to be one of the co-founders of the Academy for Emergency and Critical Care Medicine. And so at the time there wasn't a specialty, and it's kind of cool. I was with a friend of mine after we'd just gone to a conference. We were driving back from a conference and talking about what we learned, and thought it'd be kind of cool if there was a specialty in emergency and critical care for technicians. At the very same time, maybe the previous year, they had just started forming the one for the college for veterinarians. And so we thought this might be the opportune time for us to look into developing a specialty in emergency critical care. So over the course of a few years, we met at the International Veterinary Emergency Critical Care Symposium, commonly known as IVEX, got together with technicians from around the country and talked to the board of directors for the Veterinary Emergency Critical Care Society, told them what we wanted to do. And I have to say, they were extremely supportive of us forming our specialty, to the point that they provided some financial support over the years. And so we got together. There were 3 founding members: myself, a guy by the name of Craig Cornell, who's no longer in the profession, and Mel McGee, a veterinary technician. Craig was at UC Davis with me, and Mel was at Colorado State. We kind of were the founding technicians, and we got together with 3 veterinary specialists in emergency critical care, and actually made a call for charter members. We put a call out for people to see if they would qualify to be a charter member. And at the same time, NAFTA was developing the CVTS, the Committee on Veterinary Technician Specialties. And so we kind of grew together in parallel, and they had specific guidelines in terms of what they were looking for people to be charters. So we made a call for that. To make a long story short, we had probably about 40 applicants. When they submitted the credentials, we pared it down to about 12 or 14. And it was that group that actually got together, sat down, put their nose to the grindstone, and developed the processes and principles and things that we utilized to develop our first exam. We were recognized by NAFTA in 1996. By 1998, we administered the first exam and have been doing it ever since. Right now, we have probably over 500 members. And so it's a pretty strong organization. I think it's kind of formed the foundation for many of those that exist today. It's amazing that there are 16 specialties out there now. And when we first started, we would never have thought that there would be that many specialties that kind of came out of what we did initially. So we're pretty proud of what's happened over the last several years. That's kind of the short version of it. But it was a lot of hard work, dedication, and people just using their imagination and putting the work in.
Amazing. Would like to go next?
Can I go next?
Take it.
I just wanted to say my first experience with specialty medicine and mine's in anesthesia was walking by Harold's table at Western Veterinary Conference, and he was there promoting the Anesthesia Society way back when. And so I was like, yeah, we need to have this. This is something that we need to do. A friend of mine became one of the first VTSs in emergency and critical care. And she asked me if I wanted to go for the first testing of the emergency or for anesthesia. And I was just like, I guess I know some things about anesthesia. And luckily, it was enough to pass the test. So I was able to be one of the first ones to be on the anesthesia committee, the anesthesia VTS. I also was lucky enough to be able to sit on the membership there for a member at large for 6 years. So I was able to see what experience there was going on, and hoping that now that there is a lot of new blood coming into all of these VTSs, that we have a lot more people who are joining the boards and also some of the committees and everything like that, because that is something that we really, really need to get infused so that these VTSs can become stronger. We need to get a lot more people involved and a lot more people interested in sitting on the boards, becoming chairs, and participating in not just having those initials behind your name, but also supporting those VTSs. That's it.
Wonderful. Who's next?
I can go next. So when I started tracking for my VTS, the academy was already up and running. So I decided to do my VTS in dentistry. It was like one of those things, like, I think if you ask anybody who likes dentistry, they're like, oh, it's so rewarding cleaning the teeth. But I think I did it mostly because, yeah, it's very rewarding cleaning teeth and seeing the pearly whites. But it's also like gaining a lot of knowledge and like learning that not just extractions is the only option of treatment that is out there. There's lots of things that you can do for your patient besides just doing extractions. So once I started my path, it was 2 long years of logging cases, volunteering my time in specialty practice to log my advanced cases. It was like hours and hours of CE lectures and wet labs. And then of course, the best part was writing 5 case reports, and they had to be well written, technical papers. And once you get scored, you pass, you take your practical and your written exam. And now I'm part of the exam committee, so I get to torture others, not torture, but have fun and see other people go through the process too.
I'm happy to go next. So when I first joined specialty in 2009, I didn't even realize that specialty medicine was a thing. I went to tech school. I think the only thing I really knew in capacity was academia, because my tech school also partnered with U of I in Champaign-Urbana. So I just really thought it was really not in private practice at all. So I ventured out of my hometown after a few years of working general practice, kind of just stagnant with what I was doing, and was lucky enough to go to a very well-established specialty hospital in the Chicago suburbs. And when I walked in, it looked like a doctor's clinic with multiple specialties I didn't even realize existed. And at that point, I was lucky enough to join surgery. And at the time, they had just taken on 2 anesthesiologists, which I think really kind of ramped up their involvement with all the technicians and really trying to strengthen their understanding and skill set. And after a while, at our clinic, we also had a few VTSs in emergency and critical care, which also at the time, I didn't realize that technicians could even specialize in anything. And I think really having very supportive surgeons and anesthesiologists that were invested in my education and willingness to learn, I decided maybe 5 years into working in that specialty practice to pursue my VTS. My journey was not straightforward. I unfortunately was not accepted my first time and went through a lot of turmoil and frustration at myself for doing that. But I immediately picked myself back up, and the following year I applied again and thankfully got in and sat for my examination later that year. And since then, just thinking back on my own frustrations with how I might have felt like maybe things in the academy could be improved, or my communications with people that could have were mentoring me at the time, really kind of helped me decide that I would like to be part of the process, like Sharon was saying, to get involved and be that person for other applicants to provide clarity, provide support. So I think that's really also helped. And it also keeps me kind of fresh to read people's case reports and try to help them improve upon it and give them some clarity for that. So I like having my toes dipped in that way. I have moved from different practices, from well-established to startup. So it kind of keeps my brain engaged in terms of reading like these crazy cases that these technicians are pushing themselves to kind of take on through their process. So, but yeah, that's my journey.
Awesome. Well, my journey was a little bit similar. In 2012, I applied for the VTS in anesthesia, and it was a crap application. I fully admit that. And they were like, Stephen, what the heck is this? No. And then I really was, getting a little bit of pushback because I was working in the research world, trying to submit anesthesia cases. So that was a little bit more of a challenge just because the types of cases that you need to submit. And then I was like, you know what? I think we should have a VTS in lab animal. So I think I emailed you, Harold, and they said, hey, I have an MRI on this day. Can I meet with you during this MRI? And we chatted. And from there, we helped establish the, what number were we? 14th or 15th VTS Academy in Lab Animal Medicine in 2016. And I have the fun pleasure of being the executive director for the Academy to keep things on the up and up. So that's my journey.
Wonderful. Thank you guys for sharing. So the next question is kind of twofold. What did you find was the biggest challenge you had in obtaining your VTS? And then what was the biggest help or support that you had when obtaining it? Is it easier if I just call on people, make people talk?
Yes, please.
Okay. All right, Tracy, your light is green because you laughed, so you get to go
Okay.
first.
I would say one of the biggest challenges for me was that this is, I think that sometimes people think when it comes to encountering a VTS that like naturally studying and being book smart and wanting to read all of the chapters and books is something that we want to do in our spare time. And for me, that's not it. I think people are always surprised when they hear that I'm a VTS in anesthesia and that I didn't get the best grades in school. I wasn't the best student. I wasn't the best studier. I was always that type of person that crammed. And so my VTS journey really pushed my limits on making myself learn and not only taking on the really challenging cases, but pushing myself to have a deeper understanding of anesthesia, pathophysiology, pharmacology. And it was by far one of the most rewarding things. And one of the things that I told myself when I wasn't accepted the first time is to look back on and the perspective that I had, that what did I learn in that year? And how did every single one of those critical patients help me be a better technician? And I did feel that although my application the first time was good, my second application was even better because of what I took from all of those patients the first year. And in between my application years, I switched hospitals. And at first I didn't have an anesthesiologist, which I had a lot of support from the two that I initially worked with that kind of started me on my journey. And really, even before I took that leap to be a VTS, really invested time and energy and, hours after cases were done to go through what happened that day and how could we do better the next time we came across that. And so I was a little bit scared because the practice I went to, again, like I said, didn't have an anesthesiologist maybe within the first 6 months that I was there. So I'm sure some of you can attest to like having surgeons that haven't had an anesthesiologist to work with when you're like, let's put an art line, let's do this block. I was met with a little bit more resistance in the sense that they just hadn't been asked to do those things before, and having a technician be more proactive and autonomous and forward thinking, I think was a little bit of just a different change of pace. And so I, not to say that you can't be at a facility that has, a great surgeon that wants you to do all of those things. I just think at the time, when I was very much in VTS mode and wanting to do all these crazy things, they were like, whoa, who's this new girl? And I definitely got a lot more support once that anesthesiologist started, because she also came from academia with other VTSs. And so she was very much apt to like, let's try this crazy thing. Let's put him on this presser. Let's try this type of analgesic technique. So I think that was very, very helpful. Prior to moving to that practice, though, I also had a work wife that was in the department as well. So I think having somebody that's a buddy that's very interested in that with you and willing to put themselves through the ringer as well was also somebody I knew I could rely on to kind of go through the process with, especially I think between all of the academies, just sometimes reading the application can be overwhelming and you're overthinking it. So having somebody else in your corner to be like, this is what they meant at the same time was also very, very beneficial to my confidence in being able to apply.
Wonderful. Sorry,
I'd like to I'd like to touch on something that Tracy said, and I like what she said is that when she, she had a little tough time getting through the exam and everything, but then she reevaluated and kind of thought through what were the challenges and how she can make a difference. And that's one of the things I've seen with many technicians who come through and maybe even taking the exam. They come out not feeling the best about what they've done, and some may not have even passed. But what I tell them is, in the process of getting ready for the exam, there's a lot that you've learned, and no one can take that away from you. Okay, maybe you didn't pass the exam. Sure, I get that. But you also gained a lot going through that process.
Yeah.
Doing the case logs, writing case reports, having a better understanding of anatomy and physiology and the pharmacology and how things work. All you're going to do is improve the care of your patient. So even if you don't pass exam, I know we want to do that, but even if you don't, you still won.
Agreed.
Absolutely. Absolutely. Hale, do you want to tell us some challenges and what was the most beneficial thing for you?
For me?
Yeah.
Okay, all right. Well, again, I took a different path. So in my path, I didn't truly take the exam. It developed the exam, developed the process. And I think the thing that was challenging is taking an idea and making it a reality. The idea being that technicians can be specialists, and we can develop a specialist and make it something that people can be proud of, something that you have to work for, and it means something. And the process of being able to put that together, bringing people together, and agreeing on how we can make this happen, and then convincing other people. We were met with some resistance in the beginning. I remember a journal article that came out in AVMA where they were asking people, what do you think of technicians and specialists? And there's a very prominent veterinarian that's still out there today that said, what, technicians? What do we need technician specialists? What's this profession coming to? We don't need someone who administers anesthesia or someone who administers fluids, but they have totally changed their tune. They are some of the biggest advocates for technician specialists. And so I think that was one of the challenges, is just coming over that idea that we can do more than just restrain animals and carry out the doctor's orders, that we were critical thinkers, that we had a lot to contribute to patient care. And so for me, that was the challenge in terms of bringing the technician specialty into fruition.
I think that's so true. And I think one of the things that's really sad is there are still techs that are still fighting for that, fighting to be seen as somebody that does more than restrain and stuff. And so being able to have VTS, it's like, not only am I an awesome tech, but like I can go even further. So like completely agree.
And that's what our goal was. We want something else. We want to move to the next level, something for technicians to be able to reach for. And we thought that would be the next step.
Shay, can I answer Felicia's question here? Well, comment.
Yes, totally.
So I just wanted to speak to Felicia. She said a barrier for me was financial and mentorship. This is a challenge for most who don't have access to resources. When I started way back when, there were no VTSs in anesthesia other than the charter members. And so it was really hard for me in a private practice to be able to find somebody to mentor me. But I was able to access the talent that I had around me. There were a lot of great surgeons and a lot of great RVTs that were in my hospital that I was able to tap into. And we worked together trying to bring up the skills list and making sure that we were having access to the patients that needed to have those skill mastery performed on them. And then we also we were just a big community supporting each other, trying to help each other to raise each other up while we were gaining access. Because even though I was going for my anesthesia, there were still other people that were going for their emergency and critical care. So we wanted to make sure that everybody around us was able to perform those skills. So yeah, it is hard when you don't have that mentorship in your hospital because you don't have another VTS there, but there are other resources that you can tap into. And I mean, to be honest, we're in an industry where there's not shortages of jobs. So if you aren't finding the resources that you need where you are, you can always go somewhere else. It's not always the easiest challenge because change is hard and it's never easy. But sometimes change is the best thing that is going to move you forward. And so I just wanted to bring that up as, you know, one of the biggest barriers that I had was just trying to be able, not knowing what was going to be on the test, not having a true mentor, but finding those people who could be my mentors and who could help me to learn my craft a little bit better.
Can I add to that? So I definitely agree with Sharon that sometimes, you know, our practices might not be the best fit for our goals, but on the flip side of that, I've had a lot of fun conversations with applicants who maybe don't work with a specialist where the academy still allows a non-specialist to sign off, or even they're working with a specialist that might be a little bit more mature or older. And when you get that buy-in to have them support you through this VTS process, they get to learn along with you. And I've heard so many doctors say, wow, I just had this whole refresher about my specialty boards. And this was good because it's important for us to keep up to date. And I think Tracy said it earlier, you know, we have to kind of be on our toes all the time. And that's true once you become a VTS, and even in RVT, especially if you're in states like California, where you have to submit continuing education. But being a VTS is a lifelong learning process. We have to recertify every number of years, either with CE credits or writing articles, a whole hodgepodge of different things. But it can be a really fun challenge for the whole team to help one team member. And then from that one team member, it's like a domino effect, right? Like you can have this impression, this encouragement to help your other colleagues advance in the field as well.
And then, so I agree with what everybody's saying here. So definitely challenges were like being questioned or being doubted about things. Like when they ask you a question and you answer, and they're like, oh, really? Like, did that real answer? I'm like, yes. But I think a lot of DVMs, even technicians, like going through the process, like a lot of people don't like change, and even like learning and then recommending things to change, even though it was going to improve the quality of care, like you still get pushback from it. But once now that I have my VTS, it's like, it's a whole different world. Like they pull me into rooms and ask me questions about the patients, like what would be recommended by a boarded dentist. And obviously I can just give my advice and then they have to follow up through. And also financially, I mean, it is a strain, it's a challenge. I did it for going for my VTS, it was, I want to do it for myself and I don't want to owe it to anybody. And I didn't want to be tied to anybody. So I found and I was able to manage to be able to pay for everything financially myself. But it is very rewarding at the end. It's very stressful, but rewarding.
Absolutely. Do any of you feel like being a BIPOC tech had any impact on your road to being a VTS? Stephen is giggling. I'm interested why.
Oh, I'm tempering myself right now, so don't ask me right now. Go to Harold. He was also, his lip was quivering.
Yeah, no, but it wasn't quivering so much because quite honestly, I have to say, I didn't really encounter any challenges being a BIPOC person. So I may have had a little different experience, again, being at the forefront, being at the beginning, bringing people into it. It was a new thing. And so I think there was more challenges than just who I was to bring it forward.
Imeldo, Tracy.
Yeah,
Go ahead.
I can't
I was just gonna
say.
say, Go ahead.
I was just gonna say, I don't think, I mean, I've been thinking about this one and I can't really say that I encountered any challenge, that I faced any challenges because of being BIPOC.
I would agree as well. I didn't necessarily, at least, at the time or even in reflection of when you presented the questions, felt like that it was anything outright. I think location of where I was at, and I think I would like to think that my willingness to to take on new challenges, to be taught, resonated with those that were going to invest their time and effort into me, versus being being a person of color, and having that be a hindrance at all. So I think, again, being like in the Chicagoland area, it was diverse. So those clinics had a lot of diversity already within them, that it wasn't anything that I thought that was personally holding me back from pursuing a VTS.
Definitely agree. I don't feel like ethnicity or my identity had anything negatively impact, but what I can say is I'm super proud of this panel, because I have had several comments, whether it's on Instagram or Facebook or even after a conference, of people coming up to me or talking about seeing Harold or Sharon, like any of these people that we see that are not the norm within the veterinary industry, is impactful for people. I've had a girl tag me in a post saying, I'm the first in my house to go to college. I'm the first Latina that's out here speaking in my area. So it is cool, because they give us praise for making it feel more comfortable for them. We may not necessarily experience overt racism. We might be getting some bias introduced in there, but it is important for our community to see us out there and excelling, because I think we've all excelled in our own areas, and whether we know it or not, we have been a positive influence on the industry, and I'm super proud of that.
Yeah, I'd second what Steven said. I think one of the things is, I think just being out there, you can inspire people. I have had people come up to me after the fact or years later, actually, that, wow, you may not know it, but you inspired me or impacted me. Again, I don't think there's anything with race, my identity, or anything like that, but just being able to help someone, regardless of what the reason is, to inspire them and make a difference for them. To me, that's all I really care about. I'm pretty happy with that.
Like everybody else, I don't think I have had any opportunity where I can say my race has played into it, but I can say over the past few years, I'm kind of proud of the veterinary industry that we're able to now embrace diversity instead of, for years, I wouldn't even tell people I was half Asian. And now it doesn't even seem like it's an impact at all for what I do in my job, but it's more that I can be proud of my heritage and also promote it within my company and within the industry itself.
I can definitely say, coming from a teaching standpoint, it's really, really awesome to be able to show students of multiple ethnicities, all of the different VTSs, and people from different races being those. And so it absolutely is impactful, and it's super beneficial, and it really kind of shows the students something else that they can definitely reach for. So there was a question in the chat. Trying to get to that. Did anyone have any impactful experiences related to their race or other identity, positive or negative?
Well, I just shared.
I can actually think of an incident or two way back when in the exam room with clients, though. I mean, this is a client issue that has nothing to do with, advancing the profession, but I had the off client every once in a while and said, he doesn't like men, or he doesn't like Black people. And it's like, yeah, really? Okay. All right. Well, we're still going to work through this, And I just kind of pick up, just move on, just kind of ignore it, just move on, and just deal with it. But that's one thing that maybe sticks out in my mind. And it's not like it happened a lot, but it has happened on occasion.
So one impactful thing that really bothers me, and I see all the time still, even if you live in a diverse community, I think this is where implicit bias comes in. is it's not uncommon, especially in the emergency setting. We get a phone call saying, hey, we have this case coming in. And sometimes the person on the other line has an accent or doesn't speak English. And all that effort that went into getting the supplies out to help that animal diminishes or stops because it's assumed that the people coming in are not going to have money. So that's a very common thing that happens all the time. And I see people brush that off as just a thing, but it is based on prejudices people have against other people, whether it's classism, racism, sexism, whatever. It is something that happens. And I think as we diversify, we can start to speak up and say, you know what, nothing's going to change. We have an animal coming in with X, we're going to do the exact same thing for every client coming in. Because I've seen some of the most hardworking people come in where we've all assumed that they're not going to have money and they're the people that can pay in cash, when this other family comes in a big, nice, fancy truck and they're the ones that don't have money. So we need to get that out of our brain and treat everybody the same and treat all the animals the same as well.
I actually had an incident with a veterinarian that I had that discussion with, because she did a quote for a patient and she assumed by looking at this gentleman, he looked like he lived on the street, wasn't well kept, but she just assumed based upon how he looked, judging the book by the cover, that he could not afford the care that she would have offered. And so I was the one who went over the quote with the guy and took his deposit, and he pulled out these huge wads of money. He could have easily afforded what she should have done if she gave the gold standard, if you will. And I went back and told her, I said, you shouldn't have judged a book by the cover, because this guy probably could have afforded it. You didn't give him the opportunity to say yay or nay. It's not fair.
Yeah.
Awesome. Thank you. Absolutely. I mean, and we see that with students, we see that with all of that. What piece of advice would you have for young techs already in the field who are looking to obtain their VTS or in the process of obtaining their VTS?
Don't rush it. And don't take your frustration out. Look who's talking. Don't take your frustration out on social media about your application, because people watch. That does introduce bias against your application, whether you think they're professional enough to not do that. It does happen. Be careful and understand that this is a professional application. As Imeldo said earlier, this is technical writing. It needs to be good grammar, good spelling. If there's a language barrier, be very clear with the mentor committee beforehand. That will count against you if it just looks like a sloppy application. We may not say, or we may not think that spelling or grammar is going to be important when we're doing anesthesia or lab animal stuff, but it's a professional application. So treat it as such and do your very best.
I would also say probably pick a specialty that you like. And that's kind of, sounds kind of funny. That sounds kind of funny, but I've also talked to people, I want to be a specialty in emergency critical care. I want to be in anesthesia. I want to do it in internal medicine. I'm going to do all three. Well, no, that's not what specialty is.
Yeah.
Find one that really lights your fire, that you're really passionate about, and focus on that. Take the time to learn. As Stephen says, don't rush it. Take the time to learn. It wasn't meant that you're going to accomplish this in just a couple of years. This is going to be a long process. That's what it was meant to be. But it's also meant to be rewarding in the end. And so pick something that you're really passionate about. Take this time to delve deep, study, ask questions, and just study hard.
Yeah, and besides being passionate about it, what you decide to go for your BTS on, you definitely want to do it for yourself, and not because my doctor says I should go for my BTS and whatever. Definitely be something that you want to do, because at the end, you're going to be the one putting the hours into it.
I think it's definitely worth waiting or seeking out places that are going to ultimately support that, because the journey already is difficult in itself on for you to take take everything that the academy is requiring of you to learn in that process and go through the application, that I think that putting yourself and setting yourself for success in the sense that you also have teammates, doctors, leadership that are going to be supportive of you pursuing that understand your value, and the fact that you are pushing yourself to be the best technician that you can be is important. So I know that with finances and things like that can be difficult, and paying for conferences, materials, there are places that are going to be out there, and like Sharon was saying, change is hard, but there are lots of practices, doctors, leadership out there that are willing to support technicians like you. You just also sometimes just have to meet them halfway and find them too.
Absolutely. Felisa has a question.
I was going to say the continuing education venue is one of the best places that you can go to network and find those people who are going to help shape you and mentor you.
Felisa has a question about imposter syndrome. I think I go through this almost every day. And especially while you're trying to do these applications, I would say these stupid applications, but these professional and highly appropriate applications, it's terrifying. And then what's also cool after, I mean, I've seen stellar non-VTS people who could probably out-VTS me any day. But once you get these credentials, you're also going to be challenged with doctors feeling comfortable and being more aware of your skills and your knowledge and asking you. And so it is funny, even though I speak to people all the time at conferences and whatnot, it is funny to still have doctors come and ask me, hey, what would you do for this case? I was like, what? I think I still have this like PTSD as the baby tech, right? Of like, oh, the doctor does everything and I have to listen to everything. And now they're asking me, I'm like, what is happening? What is happening? But it's cool because it's the kind of collaboration I think we need in this field. One, to just do better by our patients, but two, for our own longevity and mental health. Like we need to get away from this, the doctor's word is the only word, and work as a team together, because we are seeing the different side of the patient. We are spending the most time with the patient. And our input is just as valuable, and coming together like that, we're just going to get better care overall.
I think I suffer from the imposter syndrome because I haven't really worked in the field, like worked in the field. I've dabbled more than anything else. And so sometimes I get that question and I don't know the answer, and just being honest about it and saying, I don't know, but learning from that experience and going and finding out that answer and researching it and being able to come back with the answer, I think is more important than having the right answer every single time.
And I encounter that when I lecture. Sometimes people ask me questions and I don't have the answer. Just tell them, I don't know, but we'll find out. Give me your email address. I'll get back to you. Don't try and fake it. Just be honest and endeavor to find out the answer, and then share that information.
Yeah, it's definitely a thing. I mean, imposter syndrome every time I go up and lecture. But I just came back from the Veterinary Dental Forum, and I was talking to one of my colleagues, and we're like, yeah, I definitely get imposter syndrome. But it's like all the information we have and we lecture about, we got it from our textbooks and from learning. So it's not like we're just going out there and making up things. So I know it's real information. So we can always go back and look it up again, but yeah.
So there's a question about interventional radiology and the potential for a specialty. If anyone's thought of that.
There has been some interest, but there needs to be a working group for that. And you would most likely have to work with either internal medicine or the diagnostic imaging academy. So if you're interested in that, I would reach out to those two academies and or the CVTS to get the list of names of people that are interested in that. I love IR. I used to play stents and do all kinds of fun things. So fun.
Also, another question, has anyone ran into DVMs questioning why you're doing a VTS and how you add value to the practice?
Yeah, I've run across that question before, and the reality is we want to do the best that we can for the patient care. And this is a way to raise the level of care by having more advanced knowledge and taking the time to study. And so I think it's quite simple. You're trying to raise the level of care for the patients, and that will add value to the practice. It may cause some cost savings, but also may tip people off to things that are happening early in a patient's condition, that changes are taking place that'll move you into a different direction that is going to help the patient, but it may also help the bottom line too. The reality is sometimes a lot of people are looking at the bottom line. And so I think you want to do what you can to do the best for the patient. If that becomes a little more expensive, okay, and that's what it is. But if it also saves money, that's great too. But bottom line, it's all about patient care.
I think all of us are an example of what a VTS can add to the practice. All of us have done education. All of us are training on the floor or in the conference circuit. Sharon, even with recruiting, like you're trying to find the best talent. We are adding value just sitting here talking about this experience right now. And I think when you utilize a credentialed technician, not just a VTS to their fullest extent, we have the numbers that's going to bring an extra $100,000 to the practice every year. We know that. So when we get those questions, I just throw a paper at them like, here you go. If you'd use your non-VTS staff that are credentialed to their fullest extent, we'd already be adding value, and just, I don't know, add another 15 or 20K on top of that. So happens all the time. I think that's a low blow question. From your doctor, not from you.
I see there's a question, any pearls of wisdom, or I wish I had known this before, for someone trying to start an education department with a new company. And I always come back, I mean, this is cliche, but education is power. And I think it's important that you want to train staff, or actually, I don't like to use the word train, because you train dogs. You educate your staff to do a better job. And I think there are benefits to doing that. And so I think you just have to kind of show them that there are benefits to continuing to educate your staff. Just because a person's gone to school and come out, we still need that ongoing continuing education. We need to upgrade how we do things in practice. We need to reevaluate, the standards of care that we're providing. And that can be done by someone in the education department for a new veterinary hospital. And so I think that's one of the things that you can provide, that you want to raise the standard of care. To me, it's very simple. It all goes back to patient care. I'm going to sound like a broken record by the time this is over with, but that's what it comes back to.
So true. Another question, if applicable, how has your VTS changed the way you evaluate new job opportunities?
I think it's another negotiating tool. You can come to them with your advanced list of skills and knowledge, and how you can elevate the practice elevate the care within the practice. And as much as we hate talking about money sometimes, talk about how this could potentially bring more revenue to the practice. I think another thing that a lot of VTSs are doing within their practice, whether it's a lab animal field or a specialty practice or even GP, is as VTSs, it's pretty easy for us to have a side hustle of education, and you can get race certification for your lectures and educate, I almost said train, educate the rest of the staff members within your hospital. So you can even save money by being able to educate your own team or teams in your local area. And speaking of that, I was utilized in the area to go around to different practices to educate these GP practices on things like anesthesia, pain management, with the understanding that, hey, we'd be your referral hospital if you ever needed to send a case to anyone. So there's a lot of fun opportunity with not only having a negotiating chip, but also being able to have a potentially lucrative side hustle.
Kind of thinking along that line, I know nobody ever really likes to talk about money, but that's one of the I think the biggest kind of poo-pooing on VTS that I hear people say is that it doesn't really, financially, it's not a good bet. It's not going to help people financially. So if you're thinking along those lines, do you feel like you've benefited financially, like raises or bonuses, things like that?
I never went to get my VTS to get a raise. I got a raise because of my VTS. I've gotten promotions and I've gotten positions because of my VTS, but I didn't go out to get my VTS because I wanted more money. I wanted the VTS to elevate myself in my career, in my profession. So if you're doing it for money, I think you're not doing it exactly for the best reason. But I have seen financial benefits from it for sure.
Yeah, same here. I didn't do it for money, but I did get a raise when I became a VTS, and I was able to negotiate VTS pay at the new practice I'm at, just having a VTS, even though I didn't have a VTS on what they were looking for. But just having it, I was able to negotiate, and I can say I'm doing pretty good.
Yeah, I think all of us on the panel didn't go into pursuing a VTS for the financial benefit of it. I think very much all of us were anticipating that it wouldn't be, and especially the amount of time and effort and money of ourselves that we put into it already. I think for me, though, I was fortunate to, by the time I obtained my VTS and sat for my exam, I was with a practice that when I negotiated my initial wage, once I passed my VTS, they had in a contract for me a pretty significant increase in wage once I obtained my VTS. And like I mentioned before, I said there are going to be these practices and leadership and doctors out there that want to keep you there. And obviously money talks for a lot of us in our field. I think, it's very well known that we're not quite where we need to be in terms of having living wages across the United States, but there are going to be practices that are going to show you their appreciation for the fact that you put in all the hard work in wages. So, but yes, I don't think that for myself and everyone here that we didn't do it for the money.
Early on, we used to get that question a lot when in the very early days. It actually even appeared on our brochure for the Emergency Critical Care Academy in the frequently asked questions section, will I get paid more money? And we just said, we aren't doing this for the money. We're doing it to raise our level of knowledge. And hopefully along with that, we'll earn better wages. But we do think that's going to come along in time. But the other thing is some people can be very creative too. Like Steven said, get your side hustle and you can play on your VTS credentials. So there is lecturing, there is educational consulting. There's a variety of different things. While you may not get that salary bump in the practice you're in, you can do things to bring in more income for yourself.
Yeah. I always like to ask the question back at the person. Oh, did you ask that, boarded anesthesiologist, did they do it for the money? It's like, oh, I can't ask them that. Why would you ask me that? Why did you ask a veterinarian? Why didn't you become a real doctor, work with people? Like, why would you ask me that question? That's not a fair question.
There's another question in the chat. Does anyone have experience or advice when creating a DEI committee for a new company?
Not
I can't say that I have. There are a lot of great people out there who are involved with that, who can probably definitely help with that, but I would not be one of those people.
I think however you can be inclusive as possible. I think when there is a diversity committee, a lot of it they compartmentalize. Like want, just certain aspects, and it kind of excludes other people. So I think one of the things that we've done in our company is it doesn't matter who you are. If you want to be on a committee, it doesn't matter what you identify as, what your race is, what your gender is. If you want to participate. And I think that is one of the best things that you can do, is just be inclusive of everybody.
Let's see. I think that's it. Do you guys have anything else in closing? It's 5:01 and do want to be respectful of everybody's time. Any parting thoughts?
It's been a pleasure to be here with you all today. And if you're considering VTS, I strongly encourage you to give it a long, hard look and go for it. I think you can get nothing but positive results by doing it. And so I said, just go for it.
What he said. Thank you, everybody.
Thanks, everyone.
Thank you for having me.
Thank you.
Thank you all so much. We really, really appreciate it. Thank you. Thank you.
Take care, everyone.
Cheers.
Thank you. Bye.
Bye.